Wash your hands, gather your equipment. For peri, you're going to wash the front of the vagina and the buttocks. So you're going to need 2 chucks, your plastic disposable chucks. You need 4 washcloths, okay? Your towel, your bath blanket, you need your soap, and you're going to need your basin with water. So I suggest you take all your material first and then go back and get your water. Get your water, 105. Come back, have her test it, 105. Put your bed up to working condition, wash your hands, put on your gloves. Then take your bath blanket, you're going to cover up the mannequin and roll down your sheet to expose the peri area. You're going to hold shoulder and hip, even for your mannequin. Tell the mannequin, I'm going to roll you over now. I'm on the count of 3. 3, mannequin over, and you have to remove that soiled padding that's under her. The evaluator would have put it on the mannequin already. But it's soiled, that's why you come in to do care to the person. So you must remove that one. So you take one of your chucks, remove that soiled one, put your clean one, then begin to do peri. Gotta do the mitt. So you're gonna wet your washcloth, wring it out, then apply your soap. Do not put the soap in the water, and remember, we gotta have a mitt. So once you put your mitt on, just a little bit of soap, because if you get too much too much soap in the water, you have to change your water. You don't want to have to go back and forth to that sink. So just a tap. She sees you touch the soap, she knows what you're putting on soap. You're gonna wash the top first, like we did in the nursing home. The hairy area first, and you're gonna have to rinse out that cloth, wring it out, put back on your mitt, get another soap, come back. Now you're gonna do your 3. Pinky first, down, then thumb, down, and then middle. Rinse that out. Get another, put on your mitt again, get some more soap, and now do the inside. So you put your hands right there. It's hard to open up that mannequin, but she needs to see your hand there. She'll know you're doing inside. Pinky again, thumb, down the middle. That's your wash. So get rid of that washcloth. Now you're going to use your second one to what? Rinse. So you put that in the water, bring it out, put it on your mitt, wash the top area. Well, rinse the top area first, put that in the water, put back on the mitt. That's why I told you practice your mitt. Lots of mitt putting on for PERI-CARE. So put it back on, do your 3s, rinse it out, do your other 3 for the inside. That gets chucked out now, because you're wash and rinse. That's your 2 washcloths. Get your towel, pat dry the same way, front to back. Now you're going to turn it on to the buttocks, get your 3rd washcloth, and what? Wash the butt. It's pinky, thumb, middle. Okay? Get rid of that. So the buttocks is easier. Then get your next washcloth, which is the last one, to what? Rinse. Rinse out the same way. Get rid of that washcloth. That's all 4 of them. Then you pat dry. Do not put the mannequin back down on what? That dirty, wet chuck. So now you're going to remove that chuck. That's where your second chuck comes in. And leave her with that clean, dry chuck underneath the mannequin. Cover her up. Remove your bath blanket. Pull up your side rails. You're going to empty out your water into my commode. Rinse it, empty it in the commode, dry it out, remove your gloves, wash your hands, come back, then do BCW. Bed, call light, wash your hands for that skill. That's why we're not at the sink for a very long time. We're not talking to that individual about everything that happened today. You're just telling them, I'm going to do PERI-CARE, but first I'm going to what? Wash my hands and gather my equipment and keep going. And don't wait on the evaluator, too, because your time is going. Unless she stops that timer, you just keep going around her. Like, I'm going to do PERI-CARE on you. I'm going to first go wash my hands, because while you're doing that, she can still be setting it up. You don't have to wait there, because you still have to go what? Gather your equipment. All right? And when you do catheter care, it's the same thing, except it's only half of the peri, because you're only doing 1 catheter. It'll just be 1 chuck and 2 washcloths. Peri is what? 2, because you remember, front and back. So think of 2 chucks and double your washcloths, 4. Think of the catheter, just 1 catheter, 1 chuck, and wash and rinse just needs what? 2 washcloths. So catheter is half of the peri in terms of your supply, but it's the same supplies. Okay? All
question before we start.
Good.
With
Light question before we start.
With respirations, do we have to sit?
Right. All of your vitals, pulse, respiration, and BP. You must sit down. You don't want to tower over that person.
And you said we can actually touch the person?
No.
We can't. Okay.
You gotta. That's only what someone is really shallow, and that means for you when you're at your jobs and blah blah.
Okay.
You don't have to. You will watch. Some people again will breathe up here. You see them moving up here. Some you actually gotta watch down here, and you see the movement down here. See it? So you first find out where your person is easier for you to see them breathing. Then once you get that rhythm and you see them going wherever you're gonna look at, find on the clock. When it gets onto a number, say start, come back, and just watch them breathe. A lot of times, I think volunteers try to help.
I'm about to say, y'all better be, if I get one of y'all better be like,
well, not one of these guys, but anybody. They pretty much will breathe. But please, close your eyes, look up in the air, or do things like that, because you tend to laugh, and then once you laugh, you mess up that person who's counting really bad, So just close your eyes or focus your head off of that CNA if you're the volunteer, okay? They have to do your respirations. Don't laugh, because it really screws them up.